In this video, let us understand powerful hormones that shape our bodies and influence essential aspects of our lives. Androgens. They are class of hormones that play a crucial role in the development and functioning of both male and female bodies. They are often referred to as male hormones, but they are present in both males and females. Males make more of them. Testosterone is the most common androgen. The testicles in the male reproductive system and the ovaries in the female reproductive system both produce androgens. The adrenal glands on top of each kidney, they also produce this hormone. Androgens are responsible for development of male sexual characteristics during puberty, such as the growth of facial and body hair, deepening of the voice, increased muscle mass, and sperm development. In females, androgens play a role in maintaining libido, bone density, and overall well-being. Additionally, androgens are involved in regulating the menstrual cycle in women. It aids conception and pregnancy, stimulates pubic and underarm hair growth. Blood test is done to measure the androgen levels. Its value can change throughout the day. They naturally decline with age. A woman's age, menstrual cycle stage, or menopause. These status can also affect hormone levels. Androgen can fuel the growth of prostate cancer. Some people take hormone medications to lower the body's natural production of androgen as a part of treatment for prostate cancer. On the other side, lower level of androgen or low testosterone, it can cause fatigue, anxiety, and depression, difficulty concentrating, poor exercise tolerance, low sex drive, and erectile dysfunction. It can also lead to breast development, gynecomastia in men. Excessive levels of androgen in women can lead to conditions like polycystic ovarian syndrome, which can cause irregular menstrual cycles, excess hair growth, and acne. Androgen helps genitals as the fetus develops in your uterus. At birth, some babies have disorders of sex differentiation. These conditions affect a child's reproductive organs and how the genitals look. For example, a gene mutation, it can cause androgen insufficiency syndrome or androgen insensitivity syndrome. In this case, the body doesn't respond to its androgen or testosterone. The baby has male chromosomes, but the penis may be unusually small, that is micropenis, or not fully formed. The genitals may look female or be a mix of sexes. Congenital adrenal hyperplasia, CAH. High androgen levels cause a baby with female chromosome to have genitals that look male. These versatile hormones are the driving force behind the development of both male and female characteristics. It impacts our lives. Hope you like this video. Don't forget to like, subscribe and hit that notification bell to stay updated on more informative contents. Thank you and keep smiling.